Hello and welcome. I'm Dr. Lianov. I'm the president and founder of the Global Positive Health Institute, and this is our GPHI podcast series where we explore everything related to positive psychology, positive health, healthy lifestyles, lifestyle medicine. And today I'm delighted to have as our guest Dr. Karolien van de Brekel. She is the director of Positive Health International and working on expanding this movement of positive health internationally. So welcome, Karolien. How are you?
I'm very good, thank you. I'm at the end of my working day in my general practitioner practice, and I think you are in the morning in the US, right?
Yes, exactly. So it's wonderful to have you. And I'd love for you to first start out with what grabbed your attention around this area of positive health.
Going even further backwards, I was living in the US, but also in a lot of other countries, Japan, Germany, and I saw diseases are everywhere the same, but how you deal with diseases, that's really different. And that gave me a broad perspective on health. And when I came back in the Netherlands, I heard a lecture of Machteld Huber, and she spoke about positive health. And I was always very prevention-minded, but prevention is quite of a difficult theme. Everybody's talking about it, but nobody feels responsible for it. But when I heard about health and positive health, as a family doctor, you really want to have health for your patients. I thought that's it. And she told a very personal story about her own experiences as a patient, and when she was in a residency program, and Machteld Huber explained how important it is to also find different perspectives on health and how you can, well, stimulate your own health. And there's so much power in the people themselves. And then, well, I learned about the whole concept and about the vision, the tool. And I started pioneering with this in my own practice, and it really works. I'll tell you more about this, but it's really very giving me a lot of working pleasure as a doctor. Actually, I can give you an example from like an hour ago here in my practice, where a person really shared how important it was that I don't only look to him as just a complaint, but to see the whole person and look together what he or she needs to deal with all the challenges of life people can have when they come into a GP practice.
Yes. And I'd love to hear more about that. But before we dive into that, I'd love to hear how you're using it in your own life for your own health and well-being.
Mm-hmm. I will. I thought maybe one step before is good to learn a little bit more about the whole concept, like the vision. Because I use the tool in my practice, in my daily work. It really helps to apply. But the vision of positive health started like about, I think, 15 years ago now on an international meeting in 2009 with international researchers and professionals. Because Machteld Huber, the founder of Positive Health in the Netherlands, she really started looking at what is the definition of health. And this is, as you know, like a kind of a, old-fashioned, the 1948 WHO definition. And with this group of people, they came up with a new concept, the health as the ability to adapt and self-manage in the face of social, physical, and emotional challenges. And that after that meeting, she started with research in the Netherlands, with a team, with our research team. And so she elaborated this concept with a lot of research about, what if we use a new vision on health, and with this research about a variety of indicators, she came up with 6 dimensions, and those are the 6 used in our positive health spiderweb, which is the bodily functions, the mental well-being, the meaningfulness, quality of life, the social participation, and the daily functioning. And that vision she created, but also the practical reflection tool, that is what she started to implement in the Netherlands. And when I say she is Machteld Huber, is the founder of the Institute of Positive Health in the Netherlands. That started in 2015. And then, as I said, I heard Machteld Huber speaking on a prevention a presentation. And so that's how I started to hear about it and apply it. And then if you say, like, your next question was like, how do you use this in your personal life? Well, I think it's really important to practice what you preach. It's really more authentic that you do what you say than when, for instance, I would be smoking and then ask someone to quit smoking. That's really difficult to understand, I think, for the people. So the practice what you preach is important, and it's. I also realize that's not always easy. But I'm aware how important it is to be physically and mentally fit, but also to have the right balance and other lifestyle related meaningfulness, the social well-being, other related themes. So I'm very aware, but of course I also have, like everybody, sometimes the challenges, which makes me also a person like everybody. But the nice thing is, by experiencing it for yourself, it's also easier to be able to use it with others. Because reflecting on your own health makes also to see how you use it with behavioral change. And for me, it's a very, how do you say, a very natural way of starting the conversation with people. Like, how do you do your daily life? I'm curious, like, can I get to know you better? Today I had a person with a few questions on some pains, but he also had some panic attacks. And then I said, well, let's look a little bit broader. How is it going in your life at the moment? And then he got a lot of context and understanding about his own situation, and also about the relationship of the mental and the physical well-being. So I can keep talking, but maybe you have other questions. I'm not sure.
Well, thank you. And I just want to add, because I'm keeping in mind that many of our followers are from the lifestyle medicine community, and also are maybe familiar by listening through our YouTube channel that the GPHI is promoting positive health. And when I give my talks, I often refer to positive health as this combination of the healthy lifestyles you've been talking about, but also these elements that come out of the science of positive psychology, and particularly for example, of course, relationships, social connection, but also that's a center of your model is this meaningfulness and having meaning in our lives, as well as other elements of the broader biopsychosocial model. So it's very similar, even though we don't have a very standard definition yet for positive health. There's a lot of overlap, and really your approach is stepping back and looking at all of that, but also more of that holistic approach. You know, who is this person? Person-centered care. We use that term here in the U.S.
Yeah.
We have the whole health program actually in our Veterans Affairs program as well. So there's a lot of synchrony and overlap, even though the definitions aren't exactly the same. And as we were chatting beforehand, the whole idea is to get to know a person well enough to make a difference, rather than here's just a prescription. Even if it's a healthy lifestyle prescription, they walk away. What do they do with that? It has to be in the context of their entire life and who they are and their environment. And so I just wanted to make that connection between what you're doing and what we're doing. But I would love to hear more then about how you're promoting these constructs of positive health through Positive Health International.
Yeah. Also, I think it's important to emphasize what you just said, that we all have the same goal, which is stimulating health, stimulating self-management, getting to really seeing the other. I also use it like humanizing healthcare, that we don't have the quick fix from out of the disease-oriented care. but yeah, see the whole person. And that we want to empower the people, because we won't be able to have everything fixed in the health system. I think we really need resilient communities and people looking, taking care of themselves and each other better. And positive health is really about how we use it in the Netherlands and how we bring this forward, this movement, is about supporting someone to reflect on how they are doing, but not like, where is it going wrong? Where is the problem? But what is important to you, and where do you want to go? Like, and what is it were you hoping for? Were you aiming on? What are you dreaming of? And there's this meaningfulness, and that is I also have residents here in my practice, and then I say, like, in every conversation, I want to find out, like, what makes someone's eyes sparkle. Like, what is it? What is important to someone? And you probably know this expression: instead of asking what is the matter with you, you want to ask what matters to you. And this way of, like, personalized care can be created, can be supported with a lot of tools. So we have the spider web from Positive Health we use. But from out of this spider web, I often go to, in the Netherlands, we work together with the Doctor and Lifestyle Society. They have a lifestyle wheel. So if someone is motivated and really wants to go to a better better and healthier lifestyle, then I take the next step and say, okay, here's a nice lifestyle wheel, and there's a lot of tiny steps you could take. Would that be something? But there's also, like, we have other tools like the 4-domain tool. We have the solution-oriented questions, and you probably, in positive psychology, you also probably have a lot of different supportive tools as well. And I think it's really important that we all want the same, is we want to support the person. So that's what I wanted to say, and to express how we can create synergy.
Yeah.
And then your question, I think, you asked about how we use this in our work, or
yes, how you're going about to promote this. I call it a positive health movement internationally, which GPHI is all about, and you're all about. How do we get the messages out?
Yeah. Well, I must say that it's really inspiring people. So you want to have your stories and experiences on many places: conferences, lectures, webinars, presentations. And Machteld Huber has been on, I think, on 1,000 places where she gave her story, and that made that in the Netherlands. We have it now also in our national document from our the national policy documents. We have a lot of regional policy documents where also people say, okay, positive health is the core, which is very, that took many years, but Netherlands is a small country, but still it has been really powerful. And we also have a research center about the transition. And it seems that positive health is the most successful transition in health in years. And that was not the goal itself, but it turned out that we really used the transition steps by bringing this forward. And this is, as I said, first you want to inspire people. So a lot of people get, when Machteld told her story, or when I have a story, then people have something like, aha, this is interesting, or yeah, this is something I would like to try, or I want to hear more about. So that's the first step. And when you get curious, the second step is, like, you want to learn about it. So we advise people to experience it themselves and go have a training. We have now an e-learning about the essence of positive health, which is very easy to take it in your own steps and own time. And then if you learn a little bit more about it, you want to do more training to start applying it in your daily practice. And it seems that, like, it is no rocket science. It's not that difficult, but the mindset change to not think out of disease, but to listen, to really see the other and to support the other to find their own solutions. that's not how we have been brought up in medical care. So we have, the people, all the professionals who hear this podcast, they'll probably recognize we learn diseases and we learn about the problems and we learn about medical diagnostic by medical model, that you want to go to a prescription and want to bring the people a solution. And we say instead of taking care of the people, we support them to find their own solutions. And that's a different mindset. That's the most difficult one. But whenever you get this, and I must say, all the people now in the Netherlands, we have now 300 trainers. We start now, we got a lot of questions from other countries, like, what is this about positive health in the Netherlands? Can you teach us a little bit more about what this is? With the Institute of Positive Health, which is located in the Netherlands, we decided 2 years ago that I was going to start the movement outside the Netherlands for training and implementation. After this training, if people take this, we also have support with implementation, like how can you really embed this in society or in the community. And it helps when it's not only, we started with the medical care part, but if you also have the connection with the social domain, and now I think we spoke about this before, like also with the schools and with the paramedics and with the physiotherapy and the dietitian and a lot of other colleagues, not only in the medical field. Now the movement is really broader and broader, and we have like resilient communities working from out of the same shared language. And that really is interesting, that you have like a common goal, common framework where positive health is the way of, the vision of which we try to support the people, to empower them. And of course, it's not all so easy. This sounds really like, oh yeah, let's go do this. This took us like about 10 years. Also in my own region here, I live in a suburb of Utrecht. But it's nice to see step by step how the movement grows. And we also have people who want to keep going on the old way, how they always did it. And we have more like lifestyle-minded people and people who are more open for this movement of looking broader. And you have to take a little bit more time for the consultations, and that's also the first barrier a lot of people experience. It is already so busy, so now I have to do this. But if you invest in this and take the time at the start, people don't come back as often as before, because they really can go on by themselves much easier. So I told a lot of things. I told about transition. I told a little bit about how this works here in the Netherlands, and also in my own personal region, because I still work 2.5 days in a week as a general practitioner, as a family doctor, and the other half I'm busy in countries around to bring the movement further and give training and support people with implementation.
Well, thank you. And you've mentioned trainings, and there's lots of ways that our health professionals who are interested in this can learn more. Is there a particular set of resources, references that you would recommend? There's many. Like from the Institute of Positive Health, we have the website iph.nl and then en for the English version. Then we have the website Positive Health, and then international.com. I think you probably can write all the links in the podcast notes. We have the handbook Positive Health in Primary Care, the Dutch example, or collaboration in the towards meaningful life. That's also the handbook in Dutch and English and in German, recently translated. Actually, from research point of view, we recently published the rapid review with 50 publications in the Netherlands of positive health, partly about the development of the concept, partly about implementation, different target groups, and also what we are planning to do. And I think this is important because it started practice-based from out of, I think, a dream. And a lot of people also said, like, this positive health, very interesting, but how do we know that it works? Or
Is it evidence-based yet? But in the meantime, we a lot of organizations and also our national research agenda has a lot of positive health in it at the moment. And it's interesting that we also get more and more research projects outside. We just had a nice project in innovation project in Germany, a feasibility study, which has been acknowledged to be able to start next year. So it's nice that we also start collaborating in other countries with research. And I think this is really important to be able to also show what you're doing. And I think what is nice also is that positive health is really, you can use it from child, I think from 8 years old until the end of life. It's a way of, as a conversation starter with children, a lot of young people, adolescents, with mental problems or physical problems, chronic diseases, we use positive health. We use positive health with people who, for instance, have burnout, also all kind of mental problems, adults, but also like people, young women who are pregnant, or young parents, like how are you going to arrange your life? What are your own choices? What is important? And the chronic care, like the diabetes care, cardiovascular diseases, instead of only looking at the medical part, saying, okay, we do the medical part, and we also look at what is the impact on your daily life? And instead of saying, okay, sorry, I'm a diabetic, I cannot do anything, you say, okay, you have diabetes, but there is so much more in your life, what is still there, and what is important, what matters, and what is meaningful for you. And this gives very worthwhile conversations. And actually also the oncology, palliative care, the terminal phase, advanced care planning. So it's really interesting. And as a family doctor, like general practice, I see all the people in all different life phases. And I see how nice it is to apply. But we also see more and more that specialists in hospitals start working with it. But it's still a challenge to see how do we adapt it to what we already do. So that's an interesting part.
Yes. Well, thank you. You've done a great job of describing the essence of this positive health and the positive health movement, that we're looking to transform healthcare and medicine from sort of the old-fashioned, at this point, view of just focusing on the disease and getting rid of the disease, to stepping back and really embracing the whole patient, as well as with the eye towards health and what does the patient bring to the table, their family, their environment, their entire life, to promote health, regardless of what their underlying physical disease, mental disease might be. We all have the opportunity to become our best selves. And so that's often the way I frame it. But as we close this very interesting podcast, do you have some last minute advice for our listeners who are maybe interested in this, but want to start small? Where do they start? What's a good takeaway?
I think it's easy to start. So you can download the spiderweb from the dialogue tools on our Positive Health International website, and just start to fill it in for yourself and have an interesting conversation, maybe with a friend or a colleague or a family member. That will be a first step to just discover what it is. Of course, you can order the handbook to learn a little bit more about the background, or start with an e-learning. I think it's really good and important to think in small steps, because a lot of times when people think about their health or about their life, it's always big and a lot of complicated cases and backgrounds I see here in my daily practice. But if you break it down in very small, tiny steps, then people say, okay, well, that's something I could do. And most important is that we don't fill it in, that we listen for at least like 2 minutes to hear their own story and have them actually find out their own solutions. And well, that's not so easy for the average doctor, I think. But that's really nice because it brings, when people find their own solutions, they're so much stronger than when I say you should do this. So that's something I could advise. And as I said, we try to find the sparkle in someone's eyes, the meaningfulness and the stories behind the complaints. And maybe I can end with a quote, which we have the motto in our handbook, which is about dreaming and meaningfulness. It's the quote from Antoine de Saint-Exupéry. If you want to build a ship, don't drum up the men to gather wood, divide the work and give orders. Instead, teach them to yearn for the vast and endless sea.
I love that. I love that quote. I'm familiar with it, and it's so inspirational. So it's a wonderful way to end this podcast. Thank you so much, Dr. Karolien van den Brekel, for joining us. And thank you to our listeners for following this podcast series, the GPHI podcast series. Please subscribe if you haven't already. And in the meantime, please practice everything we talk about here. Be safe, be well. Wishing you lots of further journeys into this positive sea of life. Till next time, take care, everybody. Bye-bye.
Bye. Take care.